special guest here today. I'm really excited because I partnered with them. You may have heard me talk about them on the air. If you haven't, where you been? You know what I mean? I'm glad you're watching this video now, though. I have my friends Maria and Luis from Take Care Utah. How are you guys doing today?
Hi, we're doing well. Thank you for having us here, Eric. It's so great to be here with everyone, and we're excited to share all the resources that we have for you.
So let's just start with the basic, simple question, right? That everyone probably needs to know. Who is Take Care Utah? You know, what is Take Care Utah? Maybe explain that a little bit.
I'll introduce myself. My name is Maria Guadarrama. I am with Utah Health Policy Project. This is a nonprofit organization. And under UHPP, we have the program Take Care Utah. It's a network of health access assisters that help with enrollment for Medicaid, CHIP, and the marketplace. I've been with this organization for about 4 years now. Luis Rios, he's the lead broker for the program Take Care Utah and also a health access assister. He basically taught me everything I know.
Cool.
So we offer a free service to help guide you through the options for healthcare options, and go through the process of applying, making sure that your application is approved. And then after that, the most important piece I would say is knowing how to utilize that healthcare, right?
Right.
So that's who we are. In the network of Take Care Utah, you can always visit our website, takecareutah.org. If you are outside of the Salt Lake area, feel free to enter in your zip code, and it will direct you to the nearest health enrollment site. But right now, our office is working remotely, which means that the office doors are closed, but we have been able to operate fully with all the capabilities and tools to help everyone enroll virtually.
I was basically my own boss, right? I didn't work for, technically, even with the radio station for a long time, the first part of my career, I actually was like an independent contractor to them. So, you know, that in itself, right, is, I feel like, a good example of someone who, quite frankly, myself, I didn't know how to navigate insurance, right? I Googled, right, Utah healthcare. I kind of just trusted one, and I went through the process. And luckily, I don't have, you know, any like pre-existing conditions or anything at the time. So it was pretty straightforward. But to be honest, I wish that I had more of a professional help, right? More of a look, more of people who do this. And that's really what you guys specialize in, right? Like, you guys specialize truly in helping anyone that needs it, right? I want to put that out there. It's not just that situation, but from what I'm gathering, you guys really help anyone who needs it. And by the way, the service is free, right?
We do help a lot of people in that situation, right? Where they're, you know, their own employee, their own, right, self-employed or contractor like that in that situation. And yeah, we help everybody, whoever needs assistance. Exactly, our services are free. And you know, I really like that you mentioned that, because depending on the situation, yeah, some cases are pretty straightforward.
Mm-hmm.
But like we were just kind of talking about earlier, right? Healthcare is just such a, insurance, it's such an attractive topic until you need it, you know?
Mm-hmm.
So it's good to have a resource there of someone that understands, because that's what we do, right? We understand the policy, the work, how to make it easier for you, right? How to make the application faster, easier, understandable. And, you know, everything Maria said, you know, she hit around the nail of just what is it that the things that we make sure that we do with the people that we help. Yeah.
You know, mentioned a really good point in the type of work that you do. So in the state of Utah, just this year in January, we celebrated the Medicaid expansion, right? Where before, in the past, in the state of Utah, any individual who was between the ages of 19 to 64 was not able to get health insurance, connected to health insurance.
Wow.
If they were a contractor, if they were a part-time employee, if they were a student, if they were low income, right? You had to either qualify under being 0 to 18 years old, over 65, being pregnant, or, have a disability.
Really?
So this
Wow.
year, and moving forward, another option is available now to a lot of students, a lot of like freelancers like yourself. And we want to make sure that the community is aware of that, right? Previously, perhaps people tried to apply for Medicaid and they were denied. And so now they're thinking, oh, well, I already applied a year, 2 years ago, and I got denied. But we just want to make sure that, people stay connected to their options for health insurance. And, give us a call, visit our website, schedule an appointment with us. And then that way, we can go through all the eligibility and requirement process for you.
I was just curious, with things that are going on in the world today, right? Especially during this pandemic, are you guys just slammed over there? Is it just getting crazy, or what's the day-to-day like?
This is for us, like, one of our messaging is like, yeah, during this time, this is where you need to be focusing a lot on the importance of having healthcare and having health insurance. And so, the moment this whole happened, right, like when we got sent home, in March, we just started, like, our main focus was like, how do we make sure we have the tools to assist people from our homes, because we understand that this is a time where people need this, right? And so why, I'm so, grateful for you giving us this space, right? Because we're always looking for the opportunities. Being a nonprofit, right? It's hard to do mass outreach and to connect to everybody, right, in the state of who we are and what we do. So any chances that we have to participate in things like this, we are very welcome, because we feel that, as you mentioned, that this is a very important time to understand what your options are for care, what your options are for health insurance, what's out there, what you can qualify for.
Previously to this year, to COVID-19, our communities were already experiencing, certain barriers to access healthcare.
Right.
Not only in type of policy in the state of Utah, but also, barriers that that you would think are, like you mentioned, like, oh, you think it's kind of easy and you can do it. But for, so for some families or underserved communities, we acknowledge that those barriers are big. It could be anything from language barrier, from accessing a computer, from, even having an email.
Sure.
From having access to a fax machine, right? We understand the Department of Workforce Services has this process of a lot of paper forms or paperwork. And sometimes, this is where our families kind of just end the process. They get, frustrated, or, they don't have time. A lot of people are working 1 to 2 jobs and juggling family and school and all this stuff, right? And so those barriers, we recognize even before COVID-19. And as we saw this year, COVID-19 has been a big impact on our communities of color, it has hit our communities disproportionately.
Right.
And so we kind of rushed to make sure that the capabilities to offer this service still existed. And, I will tell you that we haven't seen drastic numbers lowered as far as enrollment, but we have seen where we aren't getting as much enrollment as the previous years, right? Or even as last year.
Okay.
And I think another reason for that is, a lot of the community events had to be canceled or postponed, right?
Yeah.
And a lot of the community that we serve, that's where they're getting their information. That's where they're getting their resources. And oftentimes care fair that is set up at Horizonte, a lot of the times this is where people are getting their healthcare services.
Understood.
And so the fact that a lot of these were canceled, we just had to become more strategic in the way that we are reaching out to our communities. And so, yeah, thanks for this space. Thanks for having us here.
Yeah.
And we invite anyone that's listening to, always, if you have any doubt whether you do qualify or not, reach out to us and, we can help you, guide you through that process. Visit us at takecareutah.org. Right now, as we mentioned, since everything is virtual, we are you're able to schedule your appointment directly online with us. List in your name, your email address, and a phone number. Pick a date and a time, and with any health access assistant that you'd like some help with, and we'll reach out to you. And then I do want to mention that we offer our services in Spanish and English, and right now we also have a couple of representatives that are helping in Arabic. So we are trying to be as diverse as possible. And remember, the service is free. So we just want to make sure that everybody stays connected during this time and everyone knows their healthcare options.
That's really awesome, Maria. I love that. You actually took the question right out of my mouth. I was proud of you. You answered. It's like you could read my mind. I'm so impressed. So how about this question, right? And I know I'm going to get asked this a lot, when people hear me talk about it on the radio. How do you know if you qualify, right? Like, what's the process like? Like, maybe explain a little bit of that behind the scenes.
Yeah, right. So there's a lot of different programs, right? But just the simple is all the programs are based at this point. It's just based on your income and your household size,
Okay.
And I'll give you an example, for a family of two, let's say, two adults or, a parent and a child, you can be making up to $1,900 a month, so $1,900 a month, and you can qualify. If you're below that, then you qualify for Medicaid.
Okay.
If you're above that, then we can help you get a very low monthly cost private plan on the marketplace. An individual, let's say an individual, right? You can be making about $1,470 a month. And if you're below that, you can get Medicaid. If you're above that, we can get you in a private plan through the marketplace.
Yeah, we just want to make sure that everyone's getting as much as information as they can to know their healthcare options.
It's really great. It's really great to know this organization exists here locally in Utah, right? It makes me happy to know that we can lean on people, right, like yourselves, to navigate it, because as we know, it's so confusing, right? Like, I'm not gonna lie, going through those processes have always gone over my head personally, right? And I'm grateful that my wife works at a place where they have great benefits, and that's great because I didn't have to fill out a dang thing, but that's just not the case everywhere, even for myself before, right? So
great, Eric. Now we know that you're connected to health.
I am connected. I am, thank goodness. I got a lot of health issues now.
That's good. That makes us
late
happy.
30s, going into your 40s, trust me, it gets worse. Obviously, COVID is happening, right? It's out there. We know it. You hear about it all the time. But I'd like to hear from you guys, the professionals, right? Specifically, if people still, haven't gone down the road of getting tested, or if they get sick, right? Is the test free? Is it what how does it work?
Now, I mean, even from the beginning of March, right? There was a lot of doubt and question on the fear of like, how much am I going to be charged? I don't have money to go to the hospital. But, the test for COVID-19 continues to be free, whether you get the service at a hospital or whether you are reaching out to community organizations out, in public places. I know that the Wellness Bus, you can visit their website and they have a weekly schedule. I know that, we partner with a lot of other community organizations that are offering the service. The Salt Lake County Department also has a schedule that you can, go out into the community and check their schedule for the COVID-19. I know that the mobile clinic with Utah Partners for Health also is going around doing the flu vaccines, right? So now we've not only had the subject of COVID-19, but now also, fall, winter's coming, and we have the regular flu that, we have to,
of course
we
we do.
have to take care of ourselves.
It wouldn't be easy in 2020. Why would it be?
Right. Yeah. No, I mean, we're survivors, so and making sure that everyone, I think the most beautiful thing that I've seen is making sure everybody's kind of trying to take care of each other,
Totally.
right? Making sure that everyone's connected as far as resources. We have our Facebook page, Take Care Utah. Always feel free to visit that. We try to post as much resource information from other community partners that are offering assistance. And one of the other things too that the Department of Workforce Services came out with in the middle of the year was that a specific Medicaid coverage for COVID-19. So if for whatever reason you end up at the hospital and you don't have insurance and you need to, get this test, you are able to apply for Medicaid COVID-19 under presumptive eligibility. And this should cover the exam and anything related to COVID-19. So if you had to get some x-rays, it would cover that. It wouldn't cover like the, any additional things that you would do, like if you went to like a regular doctor's visit.
Okay.
So just be aware of that. But, we just want to make sure that families are staying connected with as much as information and resources. I know at the beginning of the year, there was this question of like, my hospital charged me the COVID-19 test.
Right.
And, this was the way that, people were able to get informed about this was, communicating between each organization. And, it was luckily it was an easy fix where, we were able to contact hospitals and say, hey, this coding, et cetera, should not be happening. And so, sometimes that's what happens with insurance, right? You're like, wait, I thought it was supposed to be like this, and I'm getting this covered, and I'm not getting this covered. And so that's one of the important things that, we want to know. We want to let the community know that we're here as well to help you navigate the usage, right?
It's not just the enrollment piece. You guys still help moving forward. Awesome. Okay. I just want to say thank you guys for the work that you guys do every single day. Seriously, I've always wanted to be in the business of helping people, and in our own way, right? Connecting the dots, us getting to our organizations together and using our loudspeaker to the community. I feel like I'm fulfilling that right now in this moment.
I feel like you are too, Eric. So Thank you for the space, and thank you for, being open to talk about health insurance, right? We know it's not always attractive, but we want to make sure that, people are staying healthy and knowing their options. So thank you for all that you're doing as well, Eric.
You're welcome, guys.